Hello. Okay, it's Tuesday. It's now day 7 of the coronavirus COVID-19 pandemic, and it does feel like a wave about to crash. I know it's already started crashing for some people in the U.S., but there is definitely an apprehension in the air as we get ready for this. So some big guidelines changes yesterday, not guidelines, but recommendations coming out from New York City, New York State, and also the CDC in terms of gatherings and what you should be doing in terms of social isolation. So that's really what I'm going to talk about today. I'm going to go through the NYC health recommendations for what we should be doing and answer a couple of questions that they've laid out the responses to. I'll go through those. And we'll also talk a little bit about the CDC guidance and also what came out of the White House in terms of recommendations on a national basis, which are obviously less stringent than what has been put out by New York to date. But there is some interesting information in there as well, so we'll talk about that briefly. There is now assumed to be widespread community transmission of COVID-19 coronavirus in New York City. So you should assume act as if all of us have been exposed. So if you are sick, you must stay home. Okay, that is underlined in bold, must stay home. Not a should stay home, must stay home if you are sick. Okay, that's put out by the city. Monitor your health carefully at home. Only seek health care if you are really sick. And we need to make sure people with severe illnesses can have access to health care, and also we protect our healthcare workers from catching this disease. So if you have mild disease, you want to be monitoring your condition at home and avoiding stressing the health system. Remember, there is no COVID-specific treatment for you through healthcare. So you want to be speaking to your care providers to figure out what you should do in terms of home monitoring. And if you do go out, you must please try to limit your interactions as much as possible. Work from home, study from home, avoid all unnecessary interactions and events. What does that mean to me? That means, well, they've already closed the restaurants, bars, etc. The city's sort of clamped down. So a lot of our movements and activities are going to be limited by what's available out in the city. So my thing is, I come to work. I am a physician, and our office is working for the city. I have a feeling we're not going to be closing, and I hope we're not going to be closing. And I'm not interested in closing. I'm happy to help. So I go to work. I go to stores that I need to purchase what I need to hang out inside. I'll go for a walk with my dog or walk with my husband and stay away from people. And that's about it. Okay, so that's really what you should be doing. And obviously, if you have any doctor's appointments that they deem are appropriate to come in person, those should also be on your list of necessary events. Everything else is off the list. No family gatherings, etc. You're doing everyone a favor. Most importantly, you're doing your older relatives a favor. Those are the people who are at risk of dying from this. So if they're telling you that you must stay home when sick, what exactly are the symptoms of COVID-19? So they are 4 things. There are a fever, which is a temperature above 100.4 Fahrenheit or 38 degrees Celsius for the metrically inclined. Sore throat, cough, and shortness of breath, which is difficulty breathing. If you have any of those symptoms and they are not due to a pre-existing underlying condition like asthma or COPD, then you should consider yourself as having COVID-19 and isolate yourself accordingly and monitor your health. So who should get tested for COVID-19? COVID-19 testing is reserved for people with severe disease like pneumonia. For the rest of people who are sick with symptoms of COVID-19, assume you have COVID-19 and stay home and monitor your condition. Most of you will have very mild disease. Do not put yourself and others and your healthcare workers at risk by going to the ER when you aren't acutely ill. That will just spread this infection. Do everyone a favor and stay home. Take your temperature twice a day. Monitor your breathing. And if you are doing okay and in touch with your doctors and feeling well enough to stay home, don't clog up the healthcare system. What should I do if I get sick with COVID-19 symptoms? If you have mild to moderate symptoms, stay at home and do not seek out testing. It will not change your outcome. You can protect those in the clinic who you might infect, as well as the healthcare workers who may get infected and will be needed to treat more serious cases. If you're over 50, reach out to your doctor. They may want to monitor you more closely. Stay at home for 7 days after your symptoms started, and you want to be fever-free without the use of Tylenol or ibuprofen for 3 days before going out. Also, if you have a sore throat or cough, those should be gone before you return to your usual routine. If you've never had a fever during this illness, stay at home until 3 days after your symptoms started improving. When you go to see a doctor and you've been having these symptoms, you want to wear a mask and you want to sit in the back of a private car by an open window. If you have more severe symptoms, like severe difficulty breathing or a high fever, go to an ER or call 911 for help. What should I do if I'm sick at home? Assume you have COVID-19. Assume you have it. You don't need a test. Assume you have it. There's been community spread. So, do not leave your home except to go to medical appointments or to pick up essentials like groceries. Don't go to school. Don't go to work. And don't use public transportation. And that includes taxis and ride shares. Okay? You're assuming that you have COVID-19. That's why you're staying home sick. Wear a face mask if available. And of course, wash your hands for 20 seconds. All the usual hygiene to make sure you're not spreading it within the house, cleaning surfaces, etc. And while you're at home, assuming you have COVID-19 and recovering, make sure to not share household items like utensils, towels, etc. with people you live with to try to minimize the risk of passing it to them. And, this one's sort of obvious. Don't have visitors come to your home. It's time to use all this cool, fancy technology and do it virtually when you need visitors.